Hello student. So let's start, that is the Ulna. So in Ayurveda, Ulna, it is also called the Antaprakoshthasti, and this bone, it is the bone of the forearm. So it should be located on the medial side of the forearm, and it is the long bone. The type of bone, it is the long bone. So as it is the long bone, so it should be divided into three parts, that is the upper end, middle shaft and the lower end. So let's see the detailed structure of the Ulna. So here in this diagram you can see that is the ulna, and you know that is the ulna, it is located on the medial side of the forearm, and as it is the long bone, so it should be divided into the three part, that is the upper end, this is the middle shaft and the lower end. So let's start from the upper end. So upper end, that consists of, this is the olecranon process, this is the coronoid process, then that is the trochlear notch, and this is the radial notch. So first, that is the olecranon process. So the olecranon process, it projects upwards from the shaft, and it has the five surfaces, that is, this is the superior surface, anterior surface, posterior surface, this is the medial surface, and this is the lateral surface. So the anterior surface here, it is articular and it forms, that is the upper part of the trochlear notch. Then the posterior surface, so this one. So the posterior surface, it forms the triangular subcutaneous area. So here you can see, and it is separated from the skin by the bursa, and inferiorly it is continuous with the posterior border of the shaft of the ulna. Then the upper part, it forms the point of the elbow, so this one. Then the medial surface, so this one. So the medial surface, it is continuous inferiorly with that the posterior surface of the shaft, and the lateral surface, so this one, it is the smooth, and the superior surface, it is in its posterior part, it shows that is the rough area. Then the coronoid process, so this one. So coronoid process, it projects forwards from the shaft just below to that the olecranon process, and it has again that the four surfaces, that is, this is the superior surface, then this is the anterior surface, then this is the medial surface, and this is the lateral surface. So let's see, that is the superior surface. So the superior surface, it should be forms the lower part of that the trochlear notch. Then the anterior surface, it is triangular. So here you can see, it is triangular and rough, and its lower corner forms the ulnar tuberosity. So here. Then the lateral surface, so this one. So the upper part of the lateral surface, it is marked by the radial notch, so here. And the annular ligament, it is attached to that the anterior and the posterior margin of this notch. The part of the lateral surface form the depressed area, so this one, for the presentation of the radial tuberosity. Then it is limited behind by a ridge called the supinator crest. Then the medial surface, so this one. So the medial surface, it is continuous with the medial surface of the shaft of the ulna. Then that is the trochlear notch, so this one. So it forms a articular surface which articulates with the trochlea of the humerus to form the elbow joint. And then the radial notch. So the radial notch, it articulates with the head of the humerus to form the superior radio-ulnar joint. Then the shaft, middle part of that is the ulna, that is called the shaft. Then the shaft has the three borders and the three surfaces. So the three borders, that is the anterior border, opposite to it posterior border, and this is the lateral border, or that is also called the interosseous border. So this one. So first, that is the interosseous or the lateral border. So it is the sharpest in the middle to fourth. So here, and inferiorly it is continuous with, that is the head of the ulna, this one. Then superiorly it is continuous with, that the supinator crest. Then anterior border. So anterior border, it is thick and rounded, and it begins above from the medial side of the ulnar tuberosity, this one. Then it passes backwards to the lower 1/3 and terminates in the medial side of the styloid process. So here. Then the posterior border. So this one. So here you can see that is the posterior border. So the posterior border, it is subcutaneous and it begins above from the apex of the triangular area. So from this region. Then it goes downwards and terminate at the base of the styloid process. So here. Then the surfaces of the shaft of the ulna. So there are the three surfaces are present: the anterior surface, the posterior surface, and the medial surface. So first, that is the anterior surface. So this one. So the anterior surface, it present between the anterior and the interosseous border. So that is the anterior border, and this is the interosseous or the lateral border. So this surface, it is called the anterior surface. The nutrient foramen, it is seen on the upper part of this surface, and it is directed upwards. And the nutrient artery, it is derived from the anterior interosseous artery. Then this is the medial surface. So this one. This is. So the medial surface, it lies between the anterior border and the posterior border. So this surface, it is the medial surface. Then the posterior surface. So here in this diagram you can see that is the posterior surface. So it is present between that the posterior border and the interosseous border. So this surface, this is the posterior surface, and this posterior surface, it is subdivided into that the three areas by the two lines. That is an oblique line which divides into upper and the lower part. So here that the oblique line is present, so it should be divided into that the upper and the lower part, and this lower part, it is again divided by the vertical line into that the medial surface and the lateral surface. So here that is the medial, and here that is the lateral area. Then the lower end. So this one. So the lower end, it is made up of the head and the styloid process. So here that is the head, and this is the styloid process, this one. So the head articulates with the ulnar notch of the radius. So that is the ulnar notch which is present on the radius, and it articulates with the head of the ulna to form the inferior radio-ulnar joint, and it is separated from the ridge joint by the articular disc. So here that is the articular disc is present. The ulnar artery and the nerve lie on the anterior aspect of the head of the ulna. Then this is the styloid process. So it projects downwards from posteromedial side of the lower end of the ulna, and posteriorly it is lies between that the head and the styloid process. There is the groove for the tendon of the extensor carpi ulnaris. So here you can see that is the groove is present on the posterior side, that is for the extensor carpi ulnaris. The side determination of the ulna. So that is the upper end, it is the hook like with its concavity here, that is called the trochlear notch, which is directed forwards. Then the lateral border. So this one, it is of the shaft, it is sharp and the crest like this one, and the pointed styloid process, it lies medial to that the rounded head of the ulna. So this one. So that denotes this is the side determination of the ulna. Then the ossification of the ulna. So that is the shaft and the most of the upper end, it is ossified from the primary center, and which is appears into that the 8th week of the intrauterine life. Then the superior part of the olecranon process, it ossifies from that is the secondary center, which appears during the 10th year and fuse with the rest of bone at the 16th year. Then that is the lower end. So it is ossified again from the secondary center and which appears during the 5th year, and it joins with the shaft at the age of the 18th year. So this is the ossification of the ulna. So let's see that is the attachment or the muscle attachment of the ulna. So as you know, here the pink color it denotes that the origin of the muscle, and the blue color it denotes that is the insertion of this muscle. So first, that is the tricep brachii. So the tricep brachii, it should be inserted on the posterior part of the superior surface of the olecranon process. So here. Then that is the anconeus, this one. So the anconeus, it is inserted on the lateral aspect of the olecranon process. Then next to it, that is the brachialis. So this one. So the brachialis, it is inserted on the anterior surface of the coronoid process. So this one. Then the supinator. So the supinator, it should be arises from the supinator crest. Then the ulnar head of the flexure digitorum superficialis. This one. So flexure digitorum superficialis, it arises from the tubercle at the upper end of the medial margin of the coronoid process. So this one. Then the pronator teres, that is the ulnar head of the pronator teres. So this one. It arises from the medial margin of the coronoid process. So this one. Then the flexure digitorum profundus. So this one. So it is arises flexure digitorum profundus. It should be arises. It is arises flexure digitorum profundus from the upper 3/4 of anterior and the medial surface of the shaft. Then the pronator quadratus. So the pronator quadratus. So here. It takes origin from the oblique ridge on the lower part of the anterior surface of the shaft. Then the flexure carpi ulnaris. So here flexure carpi ulnaris. So it arises from the medial side of the olecranon process. So this one. Then the extensor carpi ulnaris. So the extensor carpi ulnaris. So this one, that is also arises from the posterior border and the lateral part of the posterior surface. So this one. It gives the origin from above to that the downwards. That is the abductor pollicis longus. So here you can see the abductor pollicis longus. Second one, that is the extensor pollicis brevis. So this one. And the extensor indicis, this one. So these are the muscular attachment related with the ulna. So here you can see that is the other attachment related with that the ulna. First here, that is the interosseous membrane. Green color you can see, that is the interosseous membrane, and it is attached to that the interosseous border or the lateral border of the ulna. Then the oblique cord. So it is attached to that the ulnar tuberosity. Then the capsular ligament. So here you can see that is the capsular ligament of the elbow joint. It is attached to the margin of the trochlear notch to that the coronoid and the olecranon process. So this one. Then the ulnar collateral ligament. So this here. The ulnar collateral ligament of the wrist, it is attached to that the styloid process. So this one. Then the annular ligament. So here in this diagram you can see that is the annular ligament. So the annular ligament of the superior radio-ulnar joint, it is attached to the two margins of the radial notch of the ulna. So this one. Then the ulnar collateral ligament of the wrist, it is attached to that the styloid process. So here that is the styloid process. Then the articular disc of the inferior radio-ulnar joint. So here it is attached by the apex to the small rough area just lateral to that the styloid process. So here. So these are the other attachment related with that the ulna. So let's see that is the clinical points related with that the ulna. So the ulna, it is the stabilizing bone. So whenever that is the pronation and the supination position of the forearm that should be occur, so only radius it should be turned and forming that the pronation and the supination. That the ulna cannot be take part into that the pronation and the supination, because throughout the trochlear notch, that is the trochlea of that the humerus, it should be fixes into this area. So this is the stabilizing bone. Ulna, it is the stabilizing bone during the moment of the pronation and the supination. The second clinical point, that is the shaft of the ulna may be fractured either alone or along with that of the radius, and the cross union between that the radius and ulna must be prevented to preserve the pronation and the supination moment of the forearm. Then the dislocation of the elbow. So the dislocation of the elbow, it is produced by fall on the outstretched hand with elbow is slightly flexed. Then the olecranon, this one, that should be shifted posteriorly and the elbow is flexed slightly. Then the next point, that is the fracture of the olecranon, it is common and it can cause by fall on the point of the elbow. So here, and the fracture of the coronoid process, it is very much uncommon and usually it accompanies the dislocation of the elbow. So that is the fracture of that is the olecranon, it is very much common when fall on the point of the elbow. The next point, that is the Madelung's deformity. So here, so the Madelung's deformity, it is the dorsal subluxation or the displacement of the lower end of the ulna due to the retarded growth of the lower end of the radius. So this one. So that is called the Madelung deformity. So these are the clinical points related with that the ulna.